The holidays are in full swing and the new year is just around the corner. It's a time for fresh goals. Today we sit down with Dr. Christopher Reesing and Dr. Daniel Pryor from St. Alphonsus to explore weight loss options, including bariatric surgery, GLP-1 medications, and who may be a good candidate. We'll also discuss why weight loss is a spectrum and how to approach that safely. Welcome to both of you. Great to have you here.
Thank you so
much. All right,
much.
so I want to know more about bariatric surgery and who would actually benefit from a procedure like this.
So bariatric surgery is also known as weight loss surgery. There are a few different types of that can be tailored to the patient. The most common types are the sleeve gastrectomy and the gastric bypass. And really there are biggest and best tools that we can use to help someone lose weight and improve some of the medical problems that go along with that. The candidates for the surgery, it typically goes off of body mass index, which is a calculation between your height and your weight. And someone needs to be 35 to 40 or higher in order to qualify for bariatric surgery.
Okay. Tell me more, too, about the bariatric surgery program at St. Alphonsus. I understand that it's actually much more than just about surgery. Right?
It is. Yeah. It's a comprehensive program that lasts about 6 months prior to surgery. During that time, we're really teaching patients about eating behaviors and skill sets around that. They're learning about triggers for eating, learning about better health, getting their diabetes under control prior to surgery, really getting them prepared for it. So we have a multidisciplinary team, dietitian, regional dietitians, we have support groups, and then they meet with providers on a monthly basis, and they're really interacting with us, measuring what they're consuming. So it's a long process to get them ready for the surgery.
Yeah, and to make sure the surgery is really successful.
Right.
That's excellent.
Exactly, because surgery alone doesn't work well, neither do medications alone. It's really that combination of a program approach with those interventions that works.
Okay, so help us understand, what can someone expect that goes through a procedure like this?
You know, it's a process. Once we're through that preoperative pathway of care, then the surgery itself is usually about an hour to 2 hours long. Most patients will stay overnight or be discharged in the evening of the same day. Most patients don't use a lot of pain medicine postoperatively, so we find that maybe just a few pain pills because it's done robotically through small incisions.
Oh.
And then there's a quicker recovery because of that. Afterwards, they're on a progression of their diet from liquids to more soft foods, and we're seeing them at frequent intervals afterwards to make sure they're meeting their targets and having the weight loss success that they want.
Okay, and then let's talk too about GLP-1s. I mean, we've heard this quite often, and very popular topic here, but how do they actually intersect with surgical options?
Yeah, I like to think of this as a spectrum of treatment. So
Okay.
there are some people who are going to really benefit just from dietary and lifestyle changes and have a lot of success. The next step up from that may be adding a medication like a GLP-1 medication, which can really help to suppress some of the hunger drive that we as humans naturally have, and then move on to surgery. And really, all of these are tools in the toolbox that can help to make someone successfully lose weight and keep it off. GLP-1s are not perfect, though. They are great in the right setting, but they also have some drawbacks. Sometimes people deal with difficulty getting insurance to cover them. There can be unwanted side effects. And typically, if someone stops taking the medication, we see the weight come right back.
Got it. So it's not like a magic pill, if you will.
We're
it's
not.
a tool.
We're not to the magic pill yet.
Okay, but I understand too that St. Alphonsus still recently received some very exciting news. You received some certifications. So help our viewers understand what this actually means for them as patients.
So we've been an accredited center for about 5 years now, right? We've gone through recertification, but along with that, what that means to viewers is that we meet the highest standards for quality and safety by the American College of Surgeons. They come and review our program every 3 years. They make sure we follow 8 standards of quality and safety. It's a very detailed and time-consuming effort, but we implement those pathways and maintain those in between. And that leads to really good results. We're really proud of our program and our patients that go through it. That has then led to other designations for centers of excellence, so to speak, from different payers like Blue Distinction with Blue Cross and Blue Shield and several others that we've achieved. So we're very proud of that.
Yeah, that's wonderful. So where can our viewers go then if they would love to take advantage of your program, learn more? Where do they go for that information?
Our website is probably the best place to go. So stalphonsus.org/bariatric surgery, or you can Google us or find us on Facebook.
Wonderful. Dr. Riesing and
Thank you
Dr.
so
Pryor,
much.
thank you so much.
Yeah.
Really appreciate it.